A very good afternoon. A very good afternoon to all the faculty, to all the respected faculty members and participants. We are truly honored to host this online webinar in association with Dr. Rajendra Prasad, Government Medical College, Kangra. Myself, Hema, and on behalf of Infocart India Private Limited, I'm truly excited to introduce MyCalFarm. MyCalFarm, as the name itself denotes, C for computer, A for assisted, L for learning. It is a computer assisted learning technique, an innovative platform designed for undergraduates and postgraduate students, providing comprehensive and immersive experience in the field of animal experiments in pharmacology. Just a quick glance at the key features. Curriculum based learning, it is aligned to the PCI curriculum, tutorial and examination modes, intuitive graphic user interface, live videos and animations. All this makes the learning experience more engaging and effective. Before we begin, I would like to take a moment to extend a very warm welcome to our esteemed industry guests. We have with us this afternoon Dr. R. Ravindran, a very well known name and a distinguished name in pharmacology fraternity, expert in pharmacy and pharmacology, with a legacy of 35 years now. Ex Jipmer Pondicherry. He was the very first one to develop the well known software Ex-Pharm in the 1980s. CDs were freely distributed, and then came Ex-Pharm Pro. And finally, MyCalPharm was launched at IPC Hyderabad in November 2024 last year. His immense contribution in the field of pharmacology cannot be denied. We also have Dr. Atal Sood with us, Professor and Head, Department of Pharmacology, now 20 plus experience of service at Dr. Rajendra Prasad, Government Medical College, Kangra. His innumerable publications are there to his credit. Amidst us, we have another distinguished guest, Ms. Kunjan Arora, co-founder Infocart India Private Limited, is a software computer engineer with a remarkable journey spanning over 15 years plus. Her deep-rooted passion for innovation, commitment to excellence is unmatched. We at Infocart India focus on building meaningful, affordable, and technology driven tools that empower institutions, educators, and students. We now may welcome Dr. Atul Sood. Dr. Atul Sood, please.
Thank you so much for the kind words. We are really glad that you took the initiative for introducing our postgraduate students for this workshop. We hope for a delightful session. Thank you.
Can we have Dr. Ravindran, please?
Please unmute everyone. Please unmute. Ravindran sir is about to speak. Please.
Hello, can you hear me?
Right, sir.
Yes,
Yes,
sir,
sir.
you are audible.
Am I audible?
Right, sir. Audible, sir.
Okay. Okay, shall I start my demonstration? Can you see my screen?
Yes, sir.
Yeah.
No,
Okay.
sir, your screen is not visible, sir.
Screen is not visible. I have shared the screen.
Sir, your screen is visible, but you are not visible. You are not visible.
Yeah, I am not visible, but I don't know what happened to the video. Just a minute. Okay, can you see me now?
Ah, yes, sir, you are visible now. That's fine.
Okay. Good afternoon, everyone. I'm terribly sorry about the hiccup. Since now I wanted to, when I started joining, I mean, it was saying that no, the capacity was exceeded. And I was not able to join. Okay, what I'm going to do is I'm going to briefly tell you about this MyCalFarm, and I'm going to demonstrate at least a few of the experiments to you. As MyCalFarm, the introduction has already been given to you. This MyCalFarm, no, it is divided into two parts. One is Ex-Pharm and other is Excology. So Ex-Pharm contains some 6 experiments, and Excology contains, initially it was almost 26 or 27 experiments, and the new experiments are being added now. Fine. Now, almost, I hope now every one of you are aware of the simulated animal experiments and their uses. Of course, it uses now, it is used for education purpose, and as well as reduce the number of the animals. Now, if you see under the Ex-Pharm, there are 6 experiments are there. One is the effect of drugs on rabbit eye, and then Bioassay, then effect of drugs on ciliary motility of frog esophagus, and effect of drugs on blood pressure and heart rate, effect of drugs on isolated frog heart, and one more bioassay. And under Excology, there are methods. I mean, again, it is divided into 3 parts. One is methods in experimental pharmacology. The other one is experiments in isolated tissues, then experiments on whole animals. So these experiments, they are not just, they are graphics based animations, and Excology experiments, they include video also. So they tell you how to do the experiments also. So first, let me start with rabbit eye experiment. So here, first I am running the tutorial mode. The entire the procedure or whatever the methodology is divided into 2 parts. First is the tutorial mode. First you are supposed to do it tutorial mode, so that everything will be told to you. It will gives you all your every instruction and what to do and what not to do. Everything it is going to tell you. So once that is you get yourself trained. There'll be some theory also. You get yourself trained. Then you go for practice mode. That is for you'll be practicing for examination. So there, the examination mode, the instructions will not be there, and some unknown drugs will be given. You will be asked to some tasks will be given. You will be trying to answer the task. That way you can practice yourself for the examination. Then the final examination mode, mode will be run by your teachers, not by you. So first, let me start with tutorial mode. So in the tutorial mode, in the opening page, if you see, it starts with introduction. So it starts with introduction. At the bottom, if you see, at the bottom, you will see objectives. So after reading the introduction, you click objectives. You'll see the objectives, then equipment, what are the equipments needed, and you move the mouse over this one of this list. You will see the picture. Then procedure. Whatever the procedure is explained, with animated diagrams, okay, and also photographs. So everything, how to instill. So all this method, everything is explained. Then now what not to do, what precautions will you take? So this. So what precautions you will take? So all this, so everything now this you are supposed to go through. Then once the introduction is over, once you having read all these things, you can go to experiment. Go to experiment now in the laboratory. What you do is you load the animal into the restrainer. So it is a right eye and left eye. And if you see on the top of this thing, you will be seeing drug names, drug list. Drug list, no pull down menu. This is a pull down menu. Drug list is given. And if you see the other new rabbit, if you want to use a new rabbit, again you can go for, you click it, just go for a new rabbit, and you can wash eyes with saline. Then the drugs, whatever the drugs you select, that will appear here. Let us say epinephrine. The epinephrine appears here. You first start with the wash with saline. So eyes are washed. Now eyes are they're looking so small. Now what you can do is you can zoom it. Yeah, this is a maximum you can get. And if you see, the intraocular tension, is it indicated at the bottom? Now you want to test a drug. You pull the menu down and then choose one, atropine. So the epinephrine, sorry, not atropine, epinephrine. Epinephrine is chosen. Then you drag it, leave it, and then the few drops are instilled in the right eye. So immediately you can see this thing. Okay. What you can do is you can measure the parameters. So what are the parameters we are going to measure? We are going to see light reflex or not. This is the control eye. Control eye, there is a light reflex. Now, what I forgot to do is, even before giving the drug, I should have measured all these parameters. Anyway, I missed it. It's okay. So now with the epinephrine, the light reflex is preserved. It is not abolished. Then corneal reflex, I'll touch it. Then immediately the eye is closed. So here also, there is some, yeah. So if you properly touch it, the epinephrine doesn't abolish corneal reflex, the eye gets closed. Then you can measure the pupil size. Just keep it at the center, and then now each division is 1 millimeter. So that is how you measure. So here each division is 1 millimeter. You measure both the horizontal as well as the vertical measurements. And this one, now you take the average. So once it is done, then you go to observation page. Here, the right eye and left eye, you have to do both right eye and left eye, epinephrine. Left eye, I should have given the saline. Okay, normal saline. Normal saline is the control. Here you enter the readings, all these readings you can enter before and after, and also the difference. Intraocular tension, I forgot to measure it. So this is how you measure the intraocular tension. If you see 13 millimeters of mercury here this is control eye, it is 13. Here it is, it's not showing, but it is decreased. Yeah, it is 10.79 millimeters. If you see, after applying epinephrine, the intraocular tension is reduced. So all these parameters we measure and then you enter. Okay. So like this, now you go ahead with other drugs. one by one. So all these drugs we can enter. If we go the atropine. So before, suppose you want to go for another drug, either you wash it thoroughly with saline, if you want to use the same rabbit, or if you want to, you can even go for a new rabbit. So here, if you click it, you'll go for a new rabbit. You can select. Okay. And you can measure, then you can enter. Here you see the rabbit number 2. So you can give 2 different other drugs you can give. Then what you can do is you can go to answer the questions. Some questions will be there. Some 10 questions will be there. These questions have to be answered and submitted. Okay. So, sorry, something. Yeah. There are some MCQs out there. These MCQs you can work out. This is about the experiment. You can close it. Then you can generate a report. So whatever you're doing, you can generate a report and PDF will be generated and it will be saved on your computer. So this, whatever you have done, later on if you want to review it, this will be useful. So once you have finished it, then you can go back to dashboard. Okay, experiment, tutorial mode. So then you can go, when you keep on doing the other experiments also, you can go for other experiments, say dog BP. Dog BP, again, now if you see the procedure, whatever the methodology almost same. So here the objectives, equipment, and the procedure, then the whatever the procedure is there, all these procedures are explained, then the precautions and everything is explained. Then once that is over, you can go for the experiment. And here you can give some drugs. Here, here's a pull down menu. You can do some procedures, and then there are drugs out there. And the drugs, there are agonists as well as antagonists. Suppose you want to give epinephrine, click epinephrine, and inject epinephrine. So epinephrine is injected. Now, if you see epinephrine is injected, now what is happening to the BP? So what the BP goes up and then comes down, then coming back to normal. If you see the heart rate is going up and there is a slight dip, and it goes up, then comes back. So if you want to measure the BP, you have to this crosshair. This crosshair, you keep it at the top. So the BP is going up to 120, going up to 120 millimeters of mercury. If you see the heart rate is going up to 160. Then of course BP is coming down here. BP from normal BP is around 100, and here the BP is coming down to 90 or something. Okay, so this is called biphasic effect of epinephrine. So the questions will be there. Questions on biphasic effect will be there that you will be answering. So like this, one by one you have to do, and you can test agonists as well as antagonists. Now let us test one antagonist, phentolamine. Phentolamine is an alpha blocker. Let us inject phentolamine and see what happens. Phentolamine, it decreases BP. We know that the alpha blocker decreases BP. Well, it not only decreases BP, it also blocks the effect of epinephrine. So after phentolamine, let us give epinephrine and see what happens. So I am repeating epinephrine now, and let me see the difference before and after phentolamine. Now, see what is the difference between before and after phentolamine? If you see, before giving phentolamine, there is a biphasic effect. Whereas after giving phentolamine, there is only a decrease in BP. Okay, this is what is called Dale's vasomotor reversal. Okay, this phenomenon is called Dale's vasomotor reversal. So like this, no, you can give, there are agonists, say norepinephrine, isoprenoline, acetylcholine, histamine, ephedrine. So these are all agonists. And if you see, there'll be corresponding antagonists will be there. Phentolamine. So phentolamine will block alpha effect of epinephrine and norepinephrine. And if you see, if you give propranolol, it blocks the beta effect of epinephrine and isoprenoline and all those things. And atropine and acetylcholine. You give acetylcholine and then give atropine, then again give acetylcholine. Even you can try high dose of acetylcholine. So you can demonstrate the antagonistic effect of these things. Then meperamine is, you see the meperamine is, it blocks meperamine and cimetidine. It blocks histamine. Okay. So you can give agonist and see the effect, then give the blocker, and then you can see the effect. Of course, you can remove the blocker. Suppose you are given the blocker is going to stay in the system for some time. And if you want to remove the blocker, you can remove the blocker, and again you can see the effect, whether the original effect returns or not. The blocker is removed. Our entire blocker is removed. Now, if you see epinephrine, it shows the original effect. Suppose if I give, it says that no phentolamine is removed. Okay, phentolamine was acting here. Phentolamine is removed. If I give epinephrine, this thing. So now, like this, there are drugs are there. Not only drugs, as I said, initially if you see carotid occlusion, suppose if you occlude carotid arteries, what will happen? Central vagus. If you cut end of central vagus, cut the vagus, and then central vagus, you stimulate electrically, what will happen? Peripheral vagus. If you stimulate peripheral vagus, peripheral cut end of vagus, what will happen? So all these things can be demonstrated. And of course, we can let me quickly demonstrate few more program. Please tell me when I have to stop, because I'll keep on going, and if it is time, somebody please let me know. So this one is the ciliary motility of frog esophagus. The effect of drugs on ciliary motility of frog esophagus. Again, objectives, equipment, procedure. What is the procedure? Then go for experiment. So this is the frog. Frog is cut open, and then the esophagus. Esophagus is everted and then fixed on a board. Now, for some reason, there is some glitch. Yeah. Okay. So now what you do is this is a poppy seed, and then this poppy seed is I'll restart it. There is some problem here. Yeah, now it is all right. There was some problem with my computer, and now see everything is in place. So this is now frog esophagus. This is poppy seed, and these are the drugs: ringer, acetylcholine, and physostigmine, and atropine. Now what will happen is, if you set up like this, and then you drop a poppy seed on the frog esophagus, poppy seed starts moving. Okay, because of cilia. There's a frog esophagus got cilia, not human esophagus, but frog esophagus that got cilia. It moves the poppy seed. It moves the poppy seed down. So now this ciliary motility, so this speed can be altered by drugs. If you give acetylcholine and physostigmine, of course you can measure it. If you start of course you should have started when the poppy seed crosses this pin. If you see, it is fixed, the esophagus is fixed with the pins, and you can measure the distance. You can measure the time taken by the seed to cross from the caudal pins to cephalic pins to caudal pins. This is cephalic side, head side, and this is the tail side. Okay, so you can what you can do is you can measure the timing. So how much time does it take? So then now you apply the drug, then again you apply poppy seed. Then now it will tell you whether acetylcholine and physostigmine, whether now what they do to cilia. If the cilia is moving faster, because the acetylcholine and physostigmine, they stimulate the cilia will move faster. So because of that, the seed will also move very fast. So the time is reduced. The time taken for the poppy seed to cross this pin. The distance between the pins is reduced. So if you give atropine, what will happen to atropine? Atropine relaxes the cilia. So if you give atropine, the time taken by poppy seed is reduced. Let me go to. Then, of course, now there are observations. Here, the observations now, again, the same thing. You can enter the frog number, drug, reading one. You are supposed to take 3 readings. With each drug, you can acetylcholine, you can instilcholine. So with acetylcholine, you are supposed to take 3 readings. And all these 3 readings, you are supposed to enter. So enter the drug here, choose the drug, acetylcholine. So enter the readings. So once that is over, now you'll be answer the questions. So every experiment, so once it is over, then now you are supposed to answer. Students, that is, you are supposed to see the books, you are supposed to read the book, and then now you have to answer the questions. Then there will be some MCQs about the procedure, about the experiment. And then finally you can generate a report so that you can put it in your record notebook. In tutorial mode, now if you go, say one more experiment I'll demonstrate, isolated frog heart. So let me go straight to the frog heart. Now if you see the frog heart, now the heart is here. The heart is expanded here because heart is so small, and then the heart is not, it is enlarged. It is enlarged now for better visual. Okay. Now you can select a drug. Suppose you give epinephrine. Now watch it. Now when I click it here, the drug is entered here. This is though this is a glass, this thing. So entire apparatus is glass. Here there is a rubber tube. So once you give epinephrine, now the heart rate goes up. Now its amplitude goes up, heart rate goes up, everything goes up. So this is the frog ringer. Frog ringer is perfusing through the heart. So if you give, let us say, if you give acetylcholine, if I give acetylcholine, what will happen? Acetylcholine is given. Now if you see, now the heart is slowed down. Heart is slowed down. It the intent, this thing has come, amplitude has come down. So these things you can enter. Go to observation, select force of contraction. What is the force of increased, decreased? So you can write, and then you can tone. Tone can be judged by the center point. So if you see the center point is not altered, then the tone is same. Or tone may be increased or decreased. Or heart rate, the heart rate you can enter. If you see, suppose what will happen, if you see calcium chloride, what will happen? Let us see. Now you are injecting calcium chloride. Now if you inject calcium chloride, what will happen is the heart will be stopped at systole, arrested at systole for some time till the effect of calcium is over. The heart gets arrested, then it slowly comes back to normal. So this is what will happen in human beings also. Human beings, when you give intravenously calcium chloride, you have to give it very, very, very slowly. If you just push it, the patient heart is going to stop. Okay, that should not be done. So like this, now you can go for observation, then MCQs and report and everything. So now let me demonstrate a little bit about. Say, if you go for a practice, now for practice, if you go, there are examinations. If you see rabbit eye, there are 2 exams are there. And if you see dog, there are 3 exams are there. And frog esophagus, there are 2 exams. Frog heart, 2 exams. And there's an interpolation assay, there is 1 exam. So you can take, you are supposed to practice the exams, because Once you practice the exam, when you go for final exam, one of these things will be given to you. Now let me go for dog experiment. If you go for dog experiment, just go back to. Go back to dog, this thing. This is a typical one, examination one. Sorry, again. So let me take examination one, dog exam. So here the tests and drugs given, enter the observation in a table, analyze and draw conclusion and identify the nature of the drugs. Here, if you see, there are drugs are given. There are 5 or 6 unknown drugs are given. You give one by one. You give one unknown drug, and then you inject it. Unknown drug. So what is the effect? There is no effect. So what could be this? Even now, nothing. I mean, no, there is no heart also. There's absolutely no effect. So this you have to, from your knowledge which you gain from doing tutorial mode, you have to guess. Now, the second drug I have given. Now, if you see there is a decrease in BP and it's going up, if you see the heart rate goes up. So like this, then now you can go for observation. Here now you have to identify the drugs. Once you now identify the drugs, then now it will tell you. You can enter. You can see even the correct drugs. It is beneath these things. Yes. Yeah, once you enter the thing, you can see the result also. For the result, now you may have to enter password. Here, there's no password required, I think. Yeah, the result is here. The first one is saline, second one is isopranaline, and all these things. Of course, this practice exam, you don't require password. If you're going for exam, you won't be able to see the result. Actual exam, you won't be able to see the result. And once you complete all these things, then you can go click report. Again, the PDF will be generated that you can keep it. If it's a practice exam, you can keep it with you. If it is an exam, the report will be generated and then it may be printed out and the examiner will keep it and the examiner will give you marks. A practice exam, if you see frog esophagus, frog heart. All the drugs. Just not. So you can do frog heart for every experiment. You can practice. So here also the unknown drugs will be given. Okay. Here the 5 unknown drugs will be given. The procedure is same. Whatever you followed in the dog BP, the same thing you will follow. Okay. Now, here, the examination 2. The examination 2 is different from examination 1. So that is why I want to demonstrate both the unknown, both the examination, both examinations. See, if you see, the examination 1, all drugs will be unknown. So you have to guess. But here, the only one unknown will be there. All the other drugs are known drugs. Now here you have to demonstrate, once you give the unknown drug, you have to guess something and then you have to confirm it also using the interactions. Now you can give unknown drug and then see what happens. It's an unknown drug now. Heart rate is coming down, and then now this thing is coming down. You have to see. Now, what you can do is you can give some, say, blockers. You can give some blockers and see. First, you have to see, what is a drug? What drug is this? Okay. There's a heart rate is now coming down. The heart rate is coming down. It is this may be acetylcholine or there's a possibility that this may be an acetylcholine or it may be a propranolol also. There's a beta blocker. There's a beta blocker, and there is the acetylcholine. Acetylcholine may be this thing, or it may be a propranolol. But what I guess is it may be propranolol. So what I'll do is I'll give unknown drug, but I'll see whether I can block this effect of unknown with epinephrine. Okay. What I have to do is I have to inject, and immediately I have to select epinephrine, and then so that I am able to reverse the effect of So here, if you see unknown drug I have given, the unknown drug, it is reduced the amplitude and also reduce the heart rate. But when I give epinephrine, it is reversed. It gets reversed. The reverse in the sense, it has come back to normal, but then the epinephrine has not increased the amplitude. So there is the effects are counted. Both the effects are counted. So hereby now I can confirm that the unknown drug it's a propranolol, because epinephrine effect is also lost. The unknown drug is also come back to normal. So this way now I can confirm that the unknown drug is epinephrine. So this kind of interactions are possible. In the dog BP also the interactions are possible. Then frog esophagus. Frog esophagus also the interactions can be seen. So with these interactions, you will be able to confirm the unknown drugs. So once you practice exams, whatever the exams you practice, and then you can go for final exam. Final exam is supposed to be given by the teachers. So this is teachers only can operate. The students cannot operate because you'll be entering the password and all these things. And in the final exam, you write, and then one of the exams, you take one of these exams and this thing and generate a report. Teacher will give you marks. So now if I go to experiment, there is other part of experiment. Okay. Now if you see excology, there are methods in the experimental pharmacology, and so I demonstrate at least one in each one. So if you see the routes of administration, so this is a demonstration. So here you selected experiment routes of administration. Objectives is coming. Then oral. How will you give oral? Okay, mouse. We see videos. So full of video demonstrations. And also now the text is there. You can read the text. So like this intravenous, intraperitoneal, intramuscular. So all this how will you the mouse and rat? So how will you use all these routes to give drugs? So this is explained in the video. Then okay. So then there's some extra information is there. Scientists. You can see the information about scientists, and there is some glossary. You can see the glossary. You can see now the meaning of words, what exactly they mean, and also you can go for help. Okay, so then now you can go back. Yeah. Then you can do some experiments on isolated tissues. Now you can go for a dose response curve. So dose response curve again, you can go for different dose response curve for acetylcholine, dose response curve for histamine. So all these things you'll be able to do. So dose response curve for histamine. Here, if you see the, I'll just show you the setup. So objectives, no objectives are there. So once the objectives are over, then you can go for the next. So this is a setup, and then now you can, the procedure is explained in a video. This is a video. In the ecology, there'll be lots of videos. You can see the actual procedure. Then you can go for experiment. Okay. So now we can wash. Whatever you do now in actual experiments, you can do. You can wash it. Then you can now take the baseline. If you take the baseline, now baseline is coming. Then 1 microgram, it is giving instruction. Now containing, now click the test tube containing 1 microgram per ml or 5 microgram of histamine. Then select 0.05 ml. Okay. Wash, you have to wash. Yeah, just a minute. I'm not able to find the. I'm sorry, I'm not able to work out. I'm not able to find here the inject button. I don't know because of the
Okay, so
problem.
no worries, sir. We'll continue with this experiment.
Okay.
Yes.
So this, no, it takes, no, sometimes the screen might create some problems, but okay, fine. So the next one. Okay, sorry, let me go back. So then experiments on whole animals. You can see that you can know locomotor activity. You can see the locomotor activity of animals. Again, now you can start with objectives. Then you can click to continue. We see the video. It's a photooctometer. So this measures the, now you can see the count. In the counter, you can see the count. Go to experiment. So you can now treat it vehicle or disebum. So you can now treat animals with this, can administer, and then you can treat vehicles, so that now you will be seeing then the locomotor activity is seen, and see what is the difference between whether disebum it reduces or increases. Of course, it reduces. You can see whether disebum reduces the locomotor activity or increase the locomotor activity. All these things can be seen. So these are the sorry. Yes. Yeah. So all these experiments, again, tutorial mode, then you can go for practice mode also. So ecology, again, you can go for practice modes also. This also, you have practice modes. So this practice mode, you can go. This is examination mode. No, prior to examination mode, you will do the practice mode. Then finally, you go for examination. Okay. This is a very, of course, I cannot go through all the experiments in detail. And what you can thing is, you can access it, maybe through your college, and you can do each and every experiment. And each and every experiment takes time, at least half an hour time. And you have to collect data, and then you can enter it, and then you can generate report, or you can write it in your record, and you can. So this is how you learn. Okay, if you have any questions or any doubts, I'll be able to answer it.
Hello everyone, I'm Kunjan Arora. I'm from InfoCart India. Right now I'm just presenting MyCalFarm. If you just allow me, I'm just sharing my screen. I will be showing you few things which sir has already shown you so many things. Give me some time. Let me share you my screen also. So this is the MyCalFarm animal simulated software home screen. Sir, I'm just presenting one or two things, sir.
Yeah,
After
please
that,
go
sir,
ahead.
we can continue with the question and answer round.
Yeah.
So this is animal simulated software MyCalFarm. This is the our about us, and here we have our two veterans from our industry, Dr. Ravindran and Dr. C.R. Patil. We have two whole pages for them. We can see what all the contributions are by Dr. Ravindran on this page. You can anytime visit here. Then we have Dr. C.R. Patil. This is Dr. Patil. He is also here with us in the meeting only. These are the awards and recognition we can just see. So I'm just going back to the homepage now. Sir has already explained you so many experiments. This is our journey from Ex-Pharm to MyCalFarm. Ex-Pharm started in 1980 late when Ravindran sir started with Ex-Pharm in GW Basic. From there, he went in 1990 to Quick Basic. Then 97, it was Ex-Pharm in BB, Visual Basic. His website, Infanet, is also there. Then web-based animal simulated software launched by another publisher. Now, in the year 2024, we have launched MyCalFarm in the IPC last year in Hyderabad. So here we are with MyCalFarm. These are the few images which we have. These are all the experiments images which we have here. Just rapidly, I'm just showing you everything which we have here, not taking much of your time. Will not be explaining everything, please no. Going to the login. This will be our dashboard. How many experiments are there up till now? How many we have already active? Then we have the your subscription period will be there. Total number of experiments, the maximum dose experiments are there. Number of the percentage of the reports are there. Recent logins, which all student has login, which all page has been visited. How many experiments has been performed up till now? Number of the experiment used. I'm now going to the experiment here, not taking much of your time, will not show you the every experiment again and again for sure. Just show you what all we have, like sir has shown you already the effect of drug on BP and heart. So I'm just going to the equipment part just to show you what all equipments we have taken. Procedure is there.
It is fixed on the dog table in supine position.
Supine position.
Oral weight is calculated with the catheter to inject drugs. Its neck is dissected.
These are the images, actual images which were being taken when we have performed this experiment.
System and the computer display through a pressure transducer. The changes in blood pressure is graphically represented on the computer display. The left side vagus is cut into central and peripheral ends for applying electrical stimulation. Later in the trachea should be exposed. Low doses of arterial given intravenously will produce reflex tachycardia. Larger doses will lead to bradycardia. Stimulation of H1 receptors leads to a rapid onset but short-lived decrease in BP. H2 receptors induce the slow onset. Longer last.
Every experiment will be having their own set of MCQs and the written questions? Going to another experiment now. I'm just showing you what all videos we have here. Let me go to the PA2 frog practice. This is for the PA2 experiment. ACH and frog detectors. These are the equipments which we have. Chimograph is there.
Writing levers are meant for recording and magnifying the responses of isolated tissues to drugs. The levers are attached to the isolated tip tool. Simple sideway writing lever. This is used for recording breed. Starling's heart lever and Fruity's universal lever. It is used
very fast. I'm just going. I'm not waiting for the text to complete.
A drum with 100
Sherrington's revolving drum machine it is.
On which the reservoir and ideal
reservoir it is. What all purpose it's all. It is explained. Scientists who have already worked on this experiment, Claude Bernard,
78, achieved his degree in
their achievements, what contribution they are made in this experiment.
1883 to 7 October 1855.
Rudolf Magnus.
2nd September 8. Rudolf Buschheim.
Rudolf Buschheim.
From first Reid Hunt.
Reid Hunt is there.
From Oswald Schmiedeberg. From 1830 to 1921. Generally recognized as the founder of modern pharmacology. He worked at
going on fast.
Seismograph. It is the paper smoked with the soot of
definition, important terms are there.
Of the lever during the experiment are recorded. Holding the frog. Hold the frog in such a way that the thumb of the left hand is pressed against its back. The right front leg of the frog is held between index finger and middle finger of the left hand while the remaining two fingers are on its back. Left front leg and hind legs of the frog are free. Fitting is done at the junction between the cranium and atlas vertebra. This relates to the foramen magnum. The position of foramen magnum is decided by sliding the fitting needle along fitting the frog. Insert the sharp needle in the foramen magnum towards the brain and destroy a part of it. Then remove and reinsert the needle in the open spinal canal and checking the reflex to check whether the frog has been properly bit. Touch the cornea of eye with the smooth stick and see whether corneal responses have completely subsided. Also, touch and pain reflexes can be checked by superficially pricking the hind leg of the frog to see whether jerking movement occurs. A properly bit, dissecting the frog. Lay the bit frog on its back. With fine scissors, make a small V-shaped cut in the abdominal skin at the pelvic girdle. Insert the curved scissors in this V-shaped cut and make the cut in the abdominal skin up to the pectoral girdle. The underlying muscular part shows the rectus abdominis muscle.
This is how we can see the dissection was there. Taking it very fast, not taking much of your time. I'm just fast forwarding it.
Isolating the rectus abdominis muscle. Take the whole cut on one side at the pelvic girdle region. Insert the blunt side of the scissors in this opening and cut up to the pectoral girdle. Isolate the piece of about 0.5 centimeters width on one side of the central vein.
Clarity of the video, you can see it yourself.
Tying the tissue, take the isolated muscle in a petri plate containing aerated ringer solution. Pass the piece of short thread through one end of the muscle and tie a knot. Pass the longer thread through the other end of the muscle and tie a knot. Tie the end having the shorter thread to the aeration tube. Hold the longer thread along with aeration tube and transfer into the organ tube. Take care to avoid any accidental stretch on the muscle.
This is how the tissue is being mounted. First, it has been the needle is passed. It is being the complete process of tying the complete tissue, the whole tissue. We can just see how the things has been done here. I'm just fast forwarding it just to show how this thing has been done. Going to the next
Mounting
video
of
now.
lever. Tie the
Mounting.
longer thread to the lever. Maintain the tissue as such for at least 45 minutes so that it gets stabilized in the in vitro atmosphere. During this time, wash the tissue at least thrice. The tissue is washed either by draining out the physiological salt solution and refilling the organ tube or by overflowing the physiological salt solution through the organ tube.
Okay, now I have performed this experiment which sir was doing DRC, dose response curve of histamine of the guinea pig ileum. Some part of the experiment I have just performed a few up till 10 μg by ml, out of which we've taken 0.8. So I'm just completing this experiment and show you what exactly will happen. You can see the experiment, how the layout is. This is the complete setup of the experiment. After 10, we are directly taking 20, out of which 0.8 ml drug solution has to be taken, injecting into it. We can see the response on the laptop screen here. I'm just washing it. After washing, we can see it comes down again. It becomes normal. Going to the baseline. Last is taking as 40, 0.8 ml. Injecting. Washing, and after washing, we will be going to the baseline, and our experiment has been complete. We have done with all starting with 1, 5, 10, 20, and 40 μg by ml of histamine. Experiment has been completed. Now we have to go to the observation part of it. So here we can see the responses. This table has been generated automatically depending upon what all values we have taken, the drug doses we have taken, and from here we can just measure the responses. I'm just measuring the responses here, 7, 13, approximate values I'm just taking. And I'm writing it here, 7, 13, 19, 27, so these are the responses. This table has been automatically generated starting with the concentration. Whatever the concentration of histamine we have taken, it will be automatically accumulated here. Amount added to the organ bath in ml and μg, it will be there. Concentration in the organ bath, micromolar concentration in the organ bath. Then we have the log molar concentration will also be there, and these are the responses. Let me go to the percentage. Here we have here percent dose response. Formula is maximum dose upon the dose response into 100. If we here we have to write the maximum response, which is coming out to be 50 here. If I just submit the maximum dose response according to this formula for the percent dose response, my percent dose response will be calculated automatically. After submitting, I will be directly going to the draft. So this is, since this is the tutorial mode, everything is being coming automatically. Only the responses has to be written in by the students. This is the draft for the person response versus the dose. We can see it here. And this is the person response versus the log dose, which we have here. Every experiment will be accompanied by a set of MCQs. When students are performing this particular experiment, the faculty expect that the students knows the answer for all these questions. We just have to submit it. Like here, I am just taking everything as A. Every experiment will be given a set of 10 MCQs, and there will be a set of written question and answers which the faculty expect the student to write it. The students are made to write all these answers. Very simple answers are there. Name the histamine receptor agonist and antagonist. What is meant by ceiling dose and the threshold dose? These are very normal questions. After submitting, we will be getting the correct answers to the MCQs here. Also, we will be getting the correct answer for the written question and answers. As I am just going through the observation here, graph is there. Now a PDF button is also there. So every experiment, a PDF will be generated, which we go to the faculty account also, where the faculty will be able to see what all student has done and what exactly have they performed. The student, the institute logo, their address will be there, name of the student with their course detail will be there, name of the experiment, what exactly they have done, the observation table, what all values they have written, what all dose they have selected, it will be there, draft 1 and the draft 2. This is the responses which we have. Then we have the log of it, what, when the student has performed and what all they have done. This is the list of the MCQs with their correct answer and the answer which the student has written here. And also the set of the written question and answers will also be there. So this will be the one PDF which the student, which it will be done, and this particular report will go into the faculty account also, which the faculty will be able to see what they have done. Let me show you what all reports we have. This exactly will be the reports which we have. It will be in the tabular format. Let me go to the few other reports we have. We can see one college, one student is there. This is the experiment PA2 of trazocin. Here we have 4. Let me show you what all we have here. This is the log doses versus person response of phenylephrine. It is in the presence of 0.1% of trazocin, 0.2, and then 0.4. This is the actual observation of it. This is the table for observation, and observation 2 is there. We can see here it is in the responses and the person dose response is there. Then again, we have here the molar concentration, log molar, log ED50, ED50 DR, and then log. This is the log molar concentration and log DR -1. This is the log dose versus the person dose versus the person response. Out of it, the log molar concentration of the trazocin will come out here. It is 8.65. Negative is not taken. PA2 is the negative log of the molar concentration of the antagonist. So we are not taking the negative sign, which comes out to be 8.65. These are the responses of PA2 experiment. With their logs are there. Written MCQs and the questions are there. So this is one experiment here. This is again for the shield plot experiment, ACH. It is ACH in presence of atropine. I'm just showing you the PDF which is being generated when the students are just performing the experiment. The PDF will be generated here. This is one experiment for the bioassay of serotonin. 3-point essays. This is your observation table which will be made. Then after the standard one, we are going to the test solution. Then a test solution for serotonin is there. We perform the complete DRC for that. First is the standard one, then is the test one. And after that, we will be taking the values of N1, N2, and T. And then Latin square optimization is being done here. The complete calculations are also there. According to the software, we are getting the concentration of the serotonin test solution as 26.9, while the actual concentration of the given serotonin is 25, which is approximately same. So this is the responses which we have, and the logs are there. List of the MCQs and then writtens are there with their answers. Same, this is again another one, which is the bioassay of serotonin by 3-point assay. It is almost the same with the Latin square optimization is being done by responses of N1, N2, and T. Then we take the average of the responses where S1, S2, and T comes out. Here, after the calculation, concentration of the serotonin comes out to be 30.2, while the actual concentration of serotonin is 30 μg by mg. So these are the exam report. Let me show you what all exams has been done. Suppose one exam is there. The student will be getting the exam. The exam report will be there. Whatever the student will be performing, the faculty will come to know what exactly they have done. Graph is there. What all they have selected the value, graph will be generated according to that only. And after this, the faculty will be having a facility to give them remarks or marks according to their own requirement, according to their own university. So whatever they will be giving them, let's say 8 upon 10 remarks, and if they want to share the PDF, the exam PDF, whatever the student has performed will go into the faculty account only and not to the student account. So whatever they have just performed, only the faculty will be able to see. And after giving them the marks or the grade, if the faculty want, they can just share the PDF with the student. If they do not want, they can just leave it. All these results can be exported to Excel. So whatever the student has performed, their result will be exported to Excel. Here we have the feedback and the suggestion form also. If there's any kind of feedback, any kind of suggestion to improve our software, to improve if something is not working, something is there which you want us to do it, you can just write it in the suggestion form. Here we are having the feedback and the suggestion form. So whatever the feedback or the suggestion you will be giving us, we will be trying to implement that particular feedback in our software. When we have launched, we had around 31 experiments with the exam mode, but now after 1 year, we have 39 experiments. So whatever experiments you are telling us to add it, we are already adding it. One experiment, it is already under testing, which is a tail trick. So as soon as it will be done, even that will be uploaded here. These are the list of the experiments which we have. Every experiment will be given a set of the MCQs and the written answers to it. DRC, then we have the PA to PD2 listing. Then we have here bioassays. Is there any question and answer round you can please ask? So we are just opening the question and answer round. If there's any kind of doubt, any questions you want to ask, you can please ask. Ravinder sir is already there with us. If there's any doubt with anybody, please write it in the chat box, or you can please unmute also.
Madam.
If you have any question, please feel free to ask.
I hope there is no question. Any suggestions are there? You are please welcome. Everybody can ask any kind of questions are there. Ravinder sir, are you there?
Yeah, I am here. I'm very much here. Yeah. Now, chat box, no, I can't see any questions on the chat box. Chat box also. Somebody has asked about zebrafish. No, zebrafish, no, we have not. There is no simulation of zebrafish here. Maybe in future, if possible, no, we'll be able to add. And we are planning to add no more sections. Now, Ex-Pharm and Excology, we are planning to add some workshops. I just completed the workshop on statistics. This we are planning to add, and the work is going on. It is going to take some time. And also, I'm planning to add workshops on research methodology, workshop on writing up, that is how to publish a paper. So there are some 3-4 ideas we have. Of course, it is going to take some time. It is not it may take months before we make all these things ready and then before we add. So this, we are adding new experiments also. As per, if we get any suggestions, we look into the possibility, and then we create the experiment and add it. So we keep updating it, and some new things we try to add. Yes.
I think we don't have any more questions. Thank you, sir, for your kind guidance and an informative software. It is really helpful for all the PG students. Thank you so much.
Thank you.
Sorry for the inconvenience faced by everyone.
Initial technical glitch. Sorry, not able to join. So many people have joined. I think it exceeded the capacity, and then I was not able to join. It was not allowing me.
For 1 hour, the registration form is available. For certificate, you can please fill up that. Thank you so much. Emma, please.
Thank you, ma'am. MyCalFarm, as we all know, has been carefully designed to meet the needs of pharmacy institutions, also aligned to ethical considerations and delivering real life experiences. We are excited to demonstrate how they can be beneficial for your premier institutions. I would like to take this opportunity to thank our distinguished audience, and my special thanks to Dr. Ravindran, Dr. Atalsu, and Ms. Kunjan Arora for their gracious presence and encouragement and valuable insight. Should you have any questions, suggestions, or require personalized discussion or a demo for your college, we are just a call or a message away. Thank you all once again for taking out time and look forward to collaborating you in future. Have a great day ahead. Thank you once again. Have a good day.
Okay, thank you.
Thank you, Atal sir.
Thank you. I'm logging out. Thank you.
Thank you.